it's my pleasure today to be with Dr. Gary Gordon. I'm sure many of our viewers don't need an introduction, but Dr. Gordon is the father of chelation and a leading light in the field of preventative and anti-aging medicine. Now, I think today we're going to be talking about energy medicine, and in particular pulsed electronic magnetic field therapy, or something that's more commonly referred to as PEMF. So it's a real great pleasure that I'm here in front of you and I have the opportunity to hear what you have to say about the subject. Thank you.
I'm really glad to share with the world the amazing, astounding story of an approach that has been known for over 50 years as a medical approach, initially to heal a broken bone when no surgeon could heal it. And over the years, the 50 years, we've begun to find that it would also act as a muscle stimulator. It would treat people with incontinence. Later we found that it would treat depression. Recently we discovered that this approach actually helps treat brain tumors. So we have a medical device that, as the longer we study it, the more we find out that it has applications that we never initially envisioned, because in the beginning we'd never heard of stem cells and we didn't know how this healing was going on. And now we're finding that it has applications in every part of health, including improving exercise for anyone.
Well, this is really fascinating. And I just wonder if you could explain a little bit more about how it all operates and on these specific areas.
Well, the pulsed electromagnetic field device, of which there are many since it's been around for over 50 years. The bottom line is that it is always something very simple. You're going to get some power from the electric in your home, and you can convert that into magnetic energy. Normally our magnetic energy comes from the center of the earth. But we happen to live on Earth right now at a time that Earth changes, leading to pole shift, North Pole trying to become South Pole. So the normal battery that is fully charged in our battery, every cell is a battery, but the charge comes from the center of the Earth. And it right now has lost 95% of its power. So no one is fully charged today. And so the applications for pulsed electromagnetic field become as diverse as all aspects of health. But if we look at the big picture, it is as simple as laying down on a table and we could put a mat or a coil underneath your body and be putting this magnetic energy into your body. Or I can treat just somebody's knee that they don't want to have operated. I don't let my patients have their knee replaced.
So how do these actions actually work inside the body?
It's taken a few years to learn, because initially all we knew is that this broken bone nobody had healed, and if you put this magnet over the area every day for 3 or 4 months, after 3 or 4 years of not healing, it came together. But we didn't know what a stem cell was back then. We couldn't measure growth factors. So what we know is this: the cells of our body operate as a battery, and you can measure the transmembrane potential of cells and find that when they get too low, the membrane potential will lead to cancer. And when it's high, you can win races. So the trick is to find out how you can get this battery charger for everybody, because we all know when our cell phone is on the last 2 minutes of thing that we're looking for the charger. Well, all of us need the charger, and when you get the charger, not only do you increase membrane potential, which means the battery is now giving this cell the chance to put out of the cell things that it doesn't need in the cell, like too much calcium, and get into the cell things like magnesium, which means the cell now has the energy to convert our oxygen and our food into energy, which we have a big name for, adenosine triphosphate, ATP for short. But that's the power of a cell. And we know that we increase that power when we use this over any part of your body. So if you have a tumor in your breast, you should first have somebody help you get access to a coil that we can put over your breast, and it will recharge that breast cancer so that it will take up the vitamin C that we put in your vein or in your mouth. And vitamin C, actually proven at NIH, helps kill all cancer. But if the cell doesn't get the charge, it just gives you a healthier toe, but you wanted your tumor to go away. So there's an application here, whether we call it the fitness application of improved exercise or the medical application, it is as basic as life itself.
And what can this mean for the patient?
Amazingly, it can increase your circulation and decrease your pain. It gives energy to your cells. It improves bone density, so you don't have to worry about shrinking and having your spine break down with fractures and broken bones. And it gives you more flexibility. It increases range of motion, how strong you are, increases endurance. And at the same time, it gets rid of spasm, gets rid of edema, gets rid of inflammation. So it's so basic that I don't know how anyone in the future is going to practice any kind of fitness or health or medicine without making this more available to the public, because we know that you can't go in space and travel to Mars or go to the moon without having a PEMF on the ship. So if we know that we need it when you're in space, and since our Earth is losing most of its power, let's just take from what we've learned from space travel and give it to everybody.
Sounds sensible, yes. And presumably from this, it's very good for sports people and for and in that area. It's going to be a lot of benefit for pain and joints. And
It's so critical because any top athlete, when they have something go wrong, can get out of the game because they've got to have that elbow come back, that knee come back. So it's very important in terms of letting an athlete fulfill his potential, because a minor injury knocks him out. But more importantly, it is clear now from all the work I've been doing that every athlete can beat his own record if he first gets fully charged with the use of a PEMF. All athletes will be amazed. They will beat their own best records because none of the cells in our body are having the luxury of a full charge. And the Energizer Buddy showed that he needed to be fully charged to keep going, and we need to be fully charged.
And are there any specific areas where PEMF is of benefit?
Well, since we've had 50 years to begin to appreciate this wonderful tool that we have, we now have studies going on in the field of heart disease, arthritis, osteoporosis, depression, cancer. There isn't any condition that hasn't been looked at now. Anyone can go to Google and put in PEMF, and they're going to get at least 3,000 studies to look at. So when people call me and say, will this help with my child who can't learn or is really stubborn or whatever you call me about, there's probably a study that's been done about it, because when you have something that is changing people's lives as dramatically as this, we have people scheduled for heart transplant who absolutely wind up regenerating their own heart. And we have people with Parkinson's who are totally disabled. With one treatment, almost 80% of the shaking will go away. We have people who've been in a wheelchair for years with total body paralysis called Guillain-Barré, that after less than 2 months of having their own daily application to this machine, they walk on their own power. And we have autism cases that routinely start getting eye contact, and with a few more sessions wind up actually being able to verbalize and function, because this is a key step in our whole body for cells to have the energy to do their job. Now, cells have a very important job. They have to do house cleaning. And it's amazing, if you look at the effort a cell has, 40% of its energy goes just to maintain that charge. And now you're making it easy because you're letting the charge be fully recovered so that the patient is now operating at a high level. And when you have the access to this device, every part of the healing operation is improved. So the big thing is that you will also start having the energy for the poison and the toxins that's in everybody in our body.
So, Dr. Gordon, these many applications sound very much as if it's detoxification. And of course, you're known as Dr. Detox.